So today we are doing epilepsy clinic. So basically this clinic we are seeing patients, non-epileptic patients or patients who have symptoms of epilepsy but not yet diagnosed, or they're not even aware that they are living with epilepsy. So epilepsy is basically a neurological condition where there is misfiring of the brain neurons. The way it presents might be different. So the ones that mostly people, the common people know, is the one we call the tonic-clonic, where the person has that jerky movement, shakes the arms, the legs, and they go unconscious, they bite their tongue, sometimes they even urinate themselves after that. So, but there's that other type of epilepsy that mostly the common people don't know, and that is something we really need to bring the attention to the people, like what we call the absence seizures, where patient suddenly drops. There is no those jerky movement, or there's this other one where a kid will either blink their eyes or will sometimes just stare at you for long. While you are talking, even trying to talk to them, they're just like completely off, staring. So in case you notice any unusual symptoms, be it an adult person or a child that seems off, it's always advisable to seek medical help from a hospital, and so that proper diagnosis and proper treatment are done. And there's some myths in the community, you sometimes start patient on a medication, they're told, hey, no, do not start, go to so and so herbal doctor, then things get out of hand. So the truth is about epilepsy, it is a condition that is treatable, and if well managed, someone can continue with their life with quality.
So what can someone do when they have these symptoms at home? Let's say the one that people know, the one that they converse, and then foam is coming from their mouth.
Yeah.
What can someone do at home, lastly?
So basically, when an attack happens, either at home or at roadside, the most important thing is do not restrain that person. If you are the person who is helping, make sure you are safe first yourself. The second thing is, if you can put something like a pillow or like a blanket under the head of that person without restraining, to avoid him hitting the head on the ground or on the wall. So then the aspect of putting something on the mouth to avoid that tongue bite is not medically. So do not put anything on the mouth. Let that attack resolve on its own, and whenever that attack ends and the convulsion subsides, you put that patient into what we call the left lateral position, and let him sleep either on the right side, so that any foam or anything droops out, so that he doesn't swallow it. So of note, do not restrain, do not put anything onto his mouth, and once the attack ends, you can put him on either of the side, right or left.
Is there anything else you'd like to say?
The most important thing, a convulsion is an emergency. It has to be taken to a hospital. The other common things that actually I would like to bring it out today is what we call febrile convulsions, fevers that get out of hand and bring convulsions. So at home, mothers, whenever your child is feeling is having fever or there's hotness of the body, kindly attend to that urgently before it becomes a convulsion.